Hi, my name is Christina Johnson, and I'm with Group 8. We are going to be discussing diabetic medications. For this, I will be going along with a PowerPoint that I have on my computer, so I'm going to try and go back and forth. I will be discussing injectable medications. We have basically your insulin that we're going to be working with. We have 4 different types. We have rapid acting, short acting, intermediate acting, and long acting. Rapid acting insulin, the duration lasts about 3 to 5 hours in your body. The onset, when it actually starts taking effect, is about 15 minutes. The examples of this we have are Lispro, Aspart, and glucine. For the next type of insulin, it's actually a short acting. It is the most commonly used insulin for patients for a sliding, what we would consider a sliding scale. The duration is 7 to 10 hours, so it lasts about 7 to 10 hours in your body. The onset, it starts working in about 30 minutes, and this would be a regular insulin. The next one we would have would be an intermediate acting insulin, which can actually be mixed with regular insulin. This is the NPH can actually be mixed with regular insulin if that is what your provider has prescribed for you. The duration is 16 to 20 hours, so it'll last in your body 16 to 20 hours. The examples of this are going to be NPH and Lente, which is an insulin zinc. And then last we have long-acting insulin. The duration lasts 24 to 30 hours in your body. The examples of this would be Ultra Lente and Detmir or Glargine, which is also Lantus. So the insulin delivery methods we will discuss is we have different types of ways of your body getting the insulin. We have an insulin syringe or a pen, which is pretty standard. You see the syringes, hospitals use syringes all the time. Syringes are, you have an insulin syringe or pen, you have an insulin pump, which is a little less common, but they're being more used now, and an insulin inhaler, which is something that during this teaching presentation was interesting for me to figure out because I didn't even know an insulin inhaler was available to the public. Pros and cons of using an insulin syringe. The pros are that it has the most accurate dosing. There's different needle sizes that would fit patients a little more comfortably. For patients that are very thin, we have a shorter needle size, a shorter needle length. You can use the insulin syringes to mix your insulins if needed. And then they're very easily available. You can get them in a Walmart, you can get them in a CVS. Sometimes they may not even require a prescription. And most insulin syringes are covered by insurance. The cons of an insulin syringe is you may need to give yourself insulin multiple times a day, which sometimes is not very comfortable. Going on with pros and cons of insulin pens. The pros are you can use the pen to dial a dose. So this is very helpful for patients that may be visually impaired, where every time it clicks to a certain number, and they're able to count their numbers that way. Insulin pens are also color-coded, so that way your regular insulin is usually a certain color. Your NPHs are usually a certain color, so they are color-coded. They are portable, so they can fit in your pocket, in your purse, and they are less obvious than a syringe. So the pens have the little needles that you would twist onto the tip of the pen, and you can carry needles separately than the pen, and it's just very convenient. The cons are they cost a little more than a syringe. You cannot mix insulin with these if indicated. If the doctor has prescribed you to mix NPH with regular, you would not be able to do that. You'd have to give yourself 2 different injections. And again, you still may need multiple shots daily. The pros and cons of insulin pumps. The pros, administers insulin as your body needs it. It does not require shots. It is a pump that is placed on your skin directly into the subcutaneous tissue. A pro on insulin pumps is it also reduces the blood glucose variability. So the range of your blood sugars, it's an on-demand type of insulin delivery system. The cons is there's a lot of insurances that will not cover an insulin pump. Insulin pumps are used more widely with children, adolescents. They are used with adults too, but you have to maintain a very accurate glucose testing and diary in order for a lot of physicians to prescribe it. The cost is significantly high for an insulin pump, and that's why a lot of insurances will not cover these. You are at risk for diabetic ketoacidosis from the insulin pump malfunctioning, either giving too much or even not enough insulin, and you are at risk for infection or allergic reaction. Patients can get infections at the injecting at the site of the insulin pump placement if it's not kept clean and if it wasn't put on in a clean manner to begin with. Now we're going to go with the pros and cons of insulin inhalers. This was something kind of interesting for me because I never even knew these existed. The pros are they're very convenient, they're very fast acting, and there's no shots that you have to give yourself, no devices applied to the skin. The cons are there's very limited options. There's only one brand out currently right now. We have limited doses. It only comes in 4, 8, and 12 unit doses. So if you really don't need 4 units of insulin, are you really going to give it to yourself? Probably not. So that would be a con of having an insulin inhaler. And again, the cost. The insurance may not cover the insulin inhalers. Insulin inhalers, you probably would have to go through multiple different stages of trying different insulins, maybe you're at risk for bleeding because of medications you take, so you'd have to go through a lot of red tape in order to get the insurance to cover it. And insulin inhalers are not approved for those under 18 years of age. They have not been FDA approved. We can talk about some injectable medications that are non-insulin. However, whether your provider decides that they want to prescribe these or not, these are usually prescribed for type 2 diabetics. So we'll just dive into this for just a couple of seconds. These are injectable non-insulin medications, but we have Trulicity. It is a GLP-1 medication, which basically it helps with the hunger hormone. It signals your brain not to be hungry. It's a once weekly injection. It helps your body release more insulin and move the sugar from your bloodstream into your cells. We also have Victoza. It's also another GLP-1 medication. Same thing, it helps with the hunger hormone. It is once a day, which that's kind of a downfall if you don't like giving yourself injections. It also helps release more insulin and sugar from the bloodstream into the cells so your body can do its job. Something I thought was interesting with Victoza is it's typically combined with metformin or a sulfonylurea. It's typically given with some type of an oral medication for diabetes type 2. And then you also have Ozempic. It's also another GLP-1 medication. It's also once a week, does the same thing. But Ozempic has been used off-label a lot more recently to help with weight loss. So if that's something that you're trying to help, or if that's something you're trying to, lose a little bit of that weight, then maybe Ozempic might be right for you if your doctor does find you a fit for that type of medication. So that's it. I hope you enjoyed my little presentation on insulin and non-insulin injectables. Have a good day.